Hi colleagues, my name is Taylor Zuber. This is for SWG 632 regarding the social policy course or social practice course. So today I am going to discuss a little synopsis about the problem and the policy that I'm studying or working on is homelessness. So I'm just kind of doing that from like a broader perspective of people that are currently experiencing homelessness. Um, so that's my problem. And a couple of the policies I think that I'm utilizing to kind of back that up is just a societal based one or a social policy. Um, and in social policy theory, there's many dimensions to that, but specifically with homelessness, I think one of a statistical data piece serving point would be that 10% of homelessness is often utilizing 50% of resources. So that's a pretty big number when we're talking in terms of, my argument and speaking on the pro side of homelessness or how we can kind of combat that or lower that number. So that's basically insinuating or stating in one of my articles that I had reviewed that again, 10% of homelessness are often utilizing 50% of resources. So this could be health resources. So I think one thing that we could encourage those that are experiencing homelessness or Samaritans that are to become homelessness in order for them to be more productive members of society or for us to help them to become productive members of society. I think one of the things that we can really look at is examining the stakeholders. So that would be taking a deeper look at who are the stakeholders, what could we do to increase the homelessness population's means of being able to access maybe healthcare benefits, unemployment resources. Um, in addition to that, just job training, job fairs. So what resources do we currently have in the community that would be available to this population, and how could we better serve or lower those stakeholders or make it more accessible for the homelessness population to have access to those stakeholders. Now, kind of speaking on an oppositional side of that, 61 million adults in the United States live with a disability. 26%, so 1 in 4 adults is what kind of like the breakdown of that, again, in the United States, have some type of disability. So if we take a look at homelessness kind of from that graph or that point of the statistical results, um, is it the fact that homelessness is more geared or it can occur more because of the capabilities or the incapabilities in certain individuals? So rather than looking at it as a stakeholder policy, kind of that macro effect um, viewpoint in this is what causes, it's a situational occurrence in which causes homelessness. Can we kind of more narrow this down and just speak in terms of um, competency and capability? So do we kind of look at it more with a political or philosophical viewpoint of a social justice and the basic entitlements of people? So with that being said, is are we looking at this kind of through the wrong lens instead of looking at it at macro? Is it kind of more of a micro issue or a meso issue in which these people serving in those communities may have a higher population that are disabled? And then when we're looking at the disabled population, whether it be a mental health reason, physical, um, or other disability or disabled reasons, um, is this the cause of homelessness itself? So rather than, again, looking at it from the lens that macro lens and being more of a stakeholder issue, could we just narrow it down to the fact that some peoples in the community are serving as limited with limited capacities, and that is what causes their homelessness. So it isn't up to social workers or other stakeholders in the community to fix that issue. That is just solely based on the individual and their abilities or inabilities to function. I think that could kind of be a statistical result supporting both the pros and the cons of homelessness. Um, so now kind of taking a look at both of the perspectives of the issues identified, um, it's asking for, the class is asking for us to kind of discuss talking that two viewpoints, one is persuading and the other is listening, of the oppositional kind of viewpoint or perspective here. So first I'll start with the pros. So I am always very strength-based, so we'll go ahead and go with the strength-based approach with the homelessness. Um, so homelessness, is this something, again, that we can kind of look at more with a societal lens, and look at it as a social problem? So with social problems, we can kind of focus on recollecting the history of homelessness, and respond to it or react to it, by rethinking how we handle individuals that are experiencing homelessness. In the mid 19th century and onward, homelessness was more of a residential instability. Um, can we re-image how we see homelessness and help people experience homelessness or their oppressors, and social justice kind of break down those barriers and really work with individuals on tackling the realistic perspective of homelessness? Um, Again, can we also, within that fact, recognize homelessness and the key components or the key connections between health disparities? Are more folks in the community homeless due to the lack of health resources that we may have for them in the community? Um, or could it be, again, kind of just assessing that acuity level? Is it something to do with the employment resources that are available in the community? Is it the community itself, more of an urban area in which, with urban and larger cities, it could cause kind of some um, more population, or the less dense of the population in the areas. That way we don't see homelessness as prevalent in more rural communities versus urban areas. And then we could also take a look at it from a family and child perspective, kind of just strategizing. Is it in context of a community development, um, or do we need to look at it in different areas, whether that be through a homelessness shelter, um, or communities? Again, kind of assessing those stakeholders. Do we break it down by the community, child welfare departments, homelessness shelters, educational resources? Um, Taking a look at each type or each area of each variable, I guess, that plays into homelessness, rather than just looking at it as a big issue or multidimensional issue that we have in our society. Um, and then so that kind of goes into the fact, like, it is a very complex um, area in which I think we do need to continue to examine. The more examination and the more that we can reconstruct, it can help to provide a more clear framework into how we can manage and also kind of assist with homelessness in the communities that we are experiencing homelessness um, through. Okay, so then the oppositional viewpoint that I kind of want to go with, kind of just proving a point on this side of things as well too. Again, so I had mentioned earlier in the conversation, 61%, or excuse me, 61 million adults in the United States live with a disability. So that's 26%, 1 in 4. Okay, if we look at homelessness through the opposite lens, so let's say that the concept of the home and the aspect of the adequate housing. So do we look at it just as the individual? So just saying, this individual is currently functioning as a disabled member in our society. Therefore, it is their sole responsibility to recreate or reconstruct themselves, if you will, and reacclimate themselves into the community the best that they can. So do we leave it at that face value and just state here basically that the conceptual issue is kind of building on rather than the lack of homelessness, but the approach or the capabilities in which an individual may have or not have. Um, that being said, kind of breaking it down and looking at more of like a 6 dimensions along with the capabilities. So a basis of the conceptual model. Um, and in that conceptual model, homelessness as a capability or as a deprivation in a specific area or to someone's specific situation. So, with that being said, do we see it as more of a situational approach where we say, yes, that person is experiencing homelessness, but, it's due to their level of functioning or inability to function? And then do we break it down even farther from there and say that that's not really a political issue that we need to handle, but perhaps it's solely based on that person's ability to their self-worth or their self-determination. So they have low self-determination or low self-worth. That's why they're kind of experiencing homelessness. So it's just their basic entitlement of a person. So I know in NASW it kind of talks and discussed, someone's self-worth and how we're supposed to be very honorary of that. Do we just look at that as that's their self-worth, and we aren't willing to intervene or take a step forward because that person is functioning at that level? That's their baseline, so to speak. So homelessness isn't the issue that we need to address. Maybe it's other areas in that person's life that they need to address themselves before we can intervene or before anyone can intervene to help them to seek or adapt to adequate housing. So I think just taking kind of both of those viewpoints and really looking into it better to assess both perspectives and not being just pro, um, but also looking at an oppositional argument is very important as a social worker. We're definitely going to have many clients that we come across that we don't necessarily agree with or have different biases. But being able to understand someone's point of view is very important. And also, it will help us to become better social workers. So, thank you for listening and have a good rest of your day.